I started practice in 2006, and I think one clear memory that I had that kind of resonated with me that, wow, BPH is serious stuff. And that is, I was fresh out of fellowship. I was hot to trot. I was robotically trained. You felt like he could do everything. 70-year-old guy, a cowboy off of a ranch in southwest New Mexico near the Gila Mountains. His family had brought him in, and you could tell he was one of those weathered cowboys, thickened, leathered hands, grizzly, a man of few words, never smiled, but he was miserable. On the IPSS, his score was in the 30s, never sleeping, just absolutely miserable and having suprapubic pressure and pain, urgency, frequency, not a happy man. And he had fallen victim to the polypharmacy epidemic, multiple urologists, multiple medications, higher doses, and no one had bothered to do any form of data collection on his prostate, on his bladder health. Doing a prostate ultrasound, his prostate was actually 200 grams. No one had ever looked at that and figured out, hey, he's got a problem. They just kept pushing the pills on him. And so when faced with the choices of either at that time, 2006, an open, simple prostatectomy or living a miserable life, he chose the one preferred path that he could control. And so he took a gun and he shot himself and killed himself.
Holy shit.
That was memorable, right? I mean, that's, for me, I was like, wow. You come out of fellowship and you have these rosy tinted sunglasses that you wear thinking, hey, we're highly trained and we're going to go conquer the world. And you get out into the real world and you see that it's really affecting people in real ways, adversely affecting them and even ending lives. And so it was really enlightening for me.
And what I see, a lot of people, just like you mentioned, they go to the PCP, the PSA is low, so they say, hey, you're good. Do you see that patient that just because the PSA is low, they think that all the symptoms that they have is normal?
Absolutely. We as men, especially dealing with BPH, what I've learned, and we might get into this, right, when we deal with men's health, men's wellness, is that men, we wear this armor of masculinity. And something that I talked about last year on LinkedIn is that men suffer from I'm fine syndrome. I just had a guy today actually come in. He said, yeah, I totally get it because it's part of my talk track. And he's like, yeah, if you don't diagnose it, then I don't have it. And he's totally right. And what happens is that we need a better way, and that's how we'll talk later, the 5 stages of bladder health. We need a way to help pierce the armor of masculinity, have men lower their defenses and recognize that, yes, there's a problem. And then we need to come in with solutions when warranted.